When you lose both your parents within a spell of hardly a month, I mean, it was just like, I think, 9 days apart, life just loses meaning.
They say time heals, but it hasn't done much for Sisi. It's 2 years down the road since both her parents succumbed to COVID-19 at a private health facility in Kampala.
For me, what hurts most is when you spend all this money and at the end of the day, both of them just end up passing on. Yeah.
Walking back in time reminds us of what befell us. Over 15 million people died. During the pandemic, according to the estimates from the World Health Organization. Intensive care units were filled to capacity as medics worked around the clock to save lives.
We started getting patients who were bad off needing oxygen. The number increased. The following day we had 40 patients. And now by the time I'm talking now, we are having 70 patients plus. You see, even outside, we are already having 5 patients waiting to be admitted.
Oxygen became a very scarce commodity as patients queued for life support. The public healthcare system was tested with limited supply of oxygen in government and private hospitals alike. Those who opted for private healthcare had to pay heavily to keep breathing, while those who couldn't afford it, life was on the line. It was a wake-up call for governments across Africa to invest in oxygen manufacturing plants. Several commitments were made at the peak of the pandemic. It's 3 years later. What progress has been made in the efforts to ensure access to medical oxygen? We start in Uganda at the Mulago National Referral Hospital. This hospital was at the center of the COVID-19 treatment. Engineer Jojo Tim is the Commissioner of Health Infrastructure at the Ministry of Health. His job is to ensure that oxygen, just like any other medical supply, is available to patients who need it. He recalls quite clearly what the situation was like at the peak of the pandemic.
Oxygen is not supposed to be paid for in the public hospitals like any other drug. Outside the public hospitals, people pay for oxygen. Now, during COVID-19, the government had to buy oxygen. Why? Because the available oxygen plants that we had were not able to generate enough oxygen for the patients. Outside before COVID, oxygen would go for about 34,000 per cylinder. But during COVID, the demand was high, and you know the economics of demand and supply. Because of heightened demand, the cost went to 50, it went to 60. In some places, they were at 100,000 per cylinder.
Engineer Tim says that efforts have been made by the Ugandan government to construct more oxygen plants in all the regional hospitals across the country.
The future is bright. Like I said, before COVID-19, we had 15 oxygen plants in the public facilities. As I speak now, we have 48. Although out of the 48, we have 26 that are functional or operational. 22 are yet to be functionalized. Unfortunately, the 22 that are yet to be functionalized are the high capacity ones. These 22, each of them is able to supply, to generate about 300 cylinders of oxygen per day. So you are talking of 300 cylinders times 22. That is 6,600 cylinders per day.
Among them is this facility, a state-of-the-art oxygen plant that was installed at the country's National Referral Hospital, Mulago. This facility has the capacity to produce over 1,000 cylinders of oxygen per day, making a significant addition to the country's production capacity.
Now, currently, the oxygen demand for the country stands at about 5,000 cylinders. But I'm saying that these new high-capacity oxygen plants that we have in the country and we have installed, waiting to press the button and we start generating oxygen, will be able to generate for us 6,600 cylinders of oxygen, surpassing the current demand.
With this facility, all hospital wards and intensive care units are now connected with a 24-hour supply of oxygen to meet the demand. The country even has bigger plans. The procurement process for a company to produce liquid oxygen is in its final stages.
But we have a new technology where we are going to produce liquid oxygen. Now, this is normally a very big setup that can produce, first of all, a better quality of oxygen. It also produces a much more volume of oxygen than this other system. It is also energy efficient.
Uganda will not only produce medical oxygen for itself, but also for its neighbors. He, however, says that the country is faced with so many challenges.
We've had the challenge of electricity. Now, before COVID-19, our hospitals were able to run on small capacity or less capacity transformers. Now, these new plants that we have acquired require 1,000 kVA. Now, the old transformers we had in those regional referral hospitals across the country, most of them were 315 kVA. And they were designed for the hospitals. We had not designed them to take care of a huge equipment with a capacity that needs 1,000 kVA alone.
Maintaining the oxygen plants effectively and efficiently is also another daunting challenge.
Using the rule of thumb, for every investment on equipment, you need at least 1% of the cost of that equipment put aside for maintaining it per year. In the Western countries, they normally set aside at least 5% of the cost of that equipment. Now, what I'm trying to say is that if I've bought an oxygen plant at $1 million, it means I must have 1% of that per year to maintain that equipment. The total cost of all our equipment in Ministry of Health is about 3 trillion Uganda shillings. So if you multiply by just 1%, it means in a year I need about 300 billion. Yeah, I need 300 billion to maintain the equipment, from the smallest equipment to the highest level equipment in the country.
In neighboring Kenya, a lot of resources have been directed to building more oxygen plants to meet the ever-increasing demand of the patients. Dr. Nicholas Kadaga is the Vihiga Country Executive Secretary for Health.
For example, we now have more than 150 of these plants across the country, up from just around 60 that were functional pre-COVID. Number two, the government has recently invested very heavily in cylinders. I think there's just one supply system that the Ministry of Health and AMREF have recently brought in more than 26,000 cylinders to support the distribution of oxygen. There's also been a lot of investment in liquid storage tanks across many of the large hospitals across the country through the same investment. All these investments have improved our capacity to respond.
Dr. Kadaga, however, speaks of some of the challenges they are facing to produce adequate medical oxygen.
One of the inputs is also a very high cost of electricity. Kenya has a relatively higher price of electricity per kilowatt hour compared to our neighbors. So that's another input. So if the government could lower the price for production of oxygen or in industrial settings, I think that could help to lower the price. But the other big challenge that we are dealing with is the importation. We are importing using dollars, we are selling it in shillings. And the shilling has lost quite a bit of value against the dollar. So if you're still buying it at the same price that you paid for before, from Dubai, for example, you are bringing it in, and immediately because of that alone, the price in Kenya shillings goes up. that can be avoided if we have local production, because you'll have the product locally and it can be sold in Kenyan shillings. That could save the consumers.
Despite these challenges, there is hope that with focus and more commitment, the lack of medical oxygen in Kenya will be an issue of the past. Similar efforts are being made in Nigeria to make sure that the country never finds itself in a devastating state that they were in during the pandemic.
The oxygen plants we had in the country before were less than 30. Many of them were not functional. Now, the first thing we did was to get support to activate the existing oxygen plants and then to build new oxygen plants. The federal government built one oxygen plant per state in every one of the federal institutions. And later on, we're able to get support from Global Fund and from UNICEF to further build more. Today, we have over 80, 90 oxygen generation plants, beginning from less than about 30 functional before. And we are going to have at least one oxygen plant in every senatorial zone, so that we have over 100 functional oxygen plants. I will make sure that oxygen is available throughout the country. We have full oxygen sufficiency, both for private hospitals and public hospitals, even for primary healthcare centers.
As African countries strive to strengthen their public health facilities and honor commitments to produce enough medical oxygen for the population, there are still some gaps to address. Peter Ichwero is the programs manager at the Center for Health, Human Rights and Development.
What the crisis also demonstrated to us was that we are having challenges in terms of human resource, that actually training of health workers alone does not guarantee that they are able to provide medical oxygen to patients. Then the other one was that we had shortage of equipment. The oximeters that you need to test the level of oxygen in the blood was in short supply. And a number of health facilities could not actually know whether you needed oxygen or no. They would just use signs of how your condition looks like to determine whether you actually needed medical oxygen. But this is supposed to be tested using a machine called oximeter. But then most health facilities did not have this. So we've set an agreement that we need to address some of these things: human resources, equipment, but also the availability of oxygen itself.
Many of the ongoing projects for the installation of medical oxygen facilities are funded by development partners. Whilst this is greatly appreciated, Peter Ichwero warns that this trend needs to change.
External financing was key. But you know, when you have a crisis of a pandemic, everybody's fighting to protect their own people or divert resources. So it is important that governments, including Uganda, invest early and be prepared for any emergency. So that after, because you need oxygen for beyond COVID and any pandemic like that. So it is important that we do that investment at the right time and make sure that it is sustainable.
He also wants government to adopt some best practices for transporting medical oxygen to even lower health centers.
Because one of the problems is that the approaches we are using for oxygen production and distribution is costly, and that makes the final cost of oxygen actually more expensive, because we are not relying on cheaper options. The cheaper options that have been detected include the use of pipes to transport oxygen, as opposed to using cylinders, because the cost of transporting cylinders is extremely high. So if, for example, you have a medical oxygen plant in Soroti Regional Referral Hospital, that hospital must be served by pipes, not storing the oxygen in the cylinders and then distribute it around. But also those that are out of the regional referral hospital must be able to manufacture oxygen using cheaper alternative methods, not necessarily using the bigger plants and regional referral hospitals, but then to be able to manufacture within that area.
Indeed, there is significant progress that has been made in different African countries regarding the availability of medical oxygen to their citizens. There is, however, much more to be done.